Thanks, and welcome everyone to the Strategies for Managing Difficult Clinical Research Sites. I'm sure that at some point in time we've all had those sites. We all wish we did not, but people being people sometimes can be difficult. I am Gary Freeman, and I have over 30 years' experience dealing with sites as a CRA manager, a project manager, heading up clinical operations and quality assurance for CROs, as well as auditing for pharmaceutical and device companies. I have a lot of experience dealing with many difficult sites over that time frame. This is a business dealing with people, and people can sometimes be difficult to deal with. We all understand that. Even professional people can appear to be difficult at times. Our task today is to determine what makes that a difficult situation, and how can we turn it around? Is it possible for the betterment of our project? With proper techniques, and yes, some soft skills, we can make any site a productive site, and one that we enjoy working with. It's a challenge that often the CRA must endure. We'll discuss many ways to help accomplish this today. Each of us will have our own unique ways to implement many of these tips, and some methods will work better for some of us than for others. This is the challenge that we face in our occupation. So first, let's see what role you do play in this process. Indirect, direct, are we talking to the site? Are we talking to the CRA who's then going to talk to the site? Where do we come in this operation? So I know that some of you are CRAs. I believe we have a couple of project managers. We have some CRA managers, I think, and maybe some other folk on the line as well. So if you can just open your chat panel or just open your audio and let me know, how do you participate with the site? Okay, let's look from Lauren's team. If you can unmute your line and tell us, I'm not sure if you're there by yourself or there's a team of people. So how does your group relate to the site? Are you talking with them, or is this a management role that you're talking to CRAs or CRO personnel and giving them advice on how to handle this difficult site?
Yes, there's three of us here, but we kind of do both. We talk to the sites directly, and then we also manage the CRAs.
Okay.
So manage them that way also.
Okay. You might be giving them ideas on how to do it and also doing it yourselves. Okay.
Correct.
And Michelle, your team, if you can unmute and let me know, how do you interface with the sites?
We have project managers and biostat and other staff here. We talk to them directly.
Okay. Okay, perfect. Thank you. Then let's look at our learning objectives today. We're going to be looking first at what makes the site difficult. What is the cause of that? Why are they? We all have our own ideas, and we need to think of, how do we get that? How do we get the idea that it will be a difficult site or that it is a difficult site? We have to understand that rationale before we can try to implement some kind of a response that might work. We need to think about the approaches then for dealing with that difficult site. Why is that site difficult? We need to know why if we're going to be able to help them. Help the site or help the person who's going to be working with that site. We want to, in this process, develop some trending techniques to anticipate the site issues. Sometimes we can understand this before it even happens. Going in, we might anticipate some difficult sites. This might be some of those sites that are given to us from a political nature, we'll say, that we know before we even go to the site, this may be trouble. How are we going to handle that one? And sometimes I look at that, having had the responsibility and still do in my other company now, of assigning monitors. Will this monitor work well with this site, or will they not? Just from past experience with the site and perhaps with the CRA. We might need to be a little more proactive going in than we sometimes are. They're not all going to be ideal situations and all ideal sites. Can we do something to apply some proactive diagnosis then to develop a CRA communication plan? What can we do early on so that we will know if the CRA is having a problem with the site?